Hi guys, Laura here from Sepsis Education. Hope you're doing well. This week it is Mental Health Awareness Week, and I don't know if you're aware, but one of the big things that can happen after sepsis is something called post-sepsis syndrome. And there's lots of physical aspects of post-sepsis syndrome, but today we're going to be talking about the mental health aspects, because they can be tough. And so we need to be more aware for our patients. And so if we see that they are struggling, we need to let them know of the different areas that they can take. But I just want to actually let you know some of the things that can happen. So you can get flashbacks, nightmares, insomnia, stress, fear and anxiety of having a relapse, depression, brain fog and PTSD. And why do I say this? Well, because I actually had all of them. And why have I put brain fog in there? Because a lot of people would be like, well, that's not really a psychological thing. But it is. For me, it was, because I work in healthcare. And when you have the muscle memory of being able to actually do the things, and then actually having to have the fear and the anxiety and the lack of memory to write the notes, it is frustrating. It causes anxiety, and it was awful. But the big thing with me as well, when it came to the brain fog, I also had insomnia. But that insomnia was because I didn't want to go to sleep. Because every time I went to sleep, I was having nightmares and flashbacks of being back in the recovery room after surgery. I remember hearing, it's a good job that she came in, her mum and dad brought her in, because she wouldn't be here if she waited for the ambulance. I don't know if that was a dream or not, but it was so vivid that I don't think it was. I know that I was completely doped up on morphine, but I really don't think it was. But with those flashbacks, they then caused massive PTSD, and I actually had to go for counselling. I had CBT, and I'm one of the lucky ones that it didn't take me long to be able to move forward. However, for some people it takes a long time. However, I felt that it had given me purpose again, because I was saying, right, okay, at the moment I'm writing a book as well as doing all of this. And it was saying, right, okay, I'm writing this book, I'm doing this, doing this. It gave me a framework and it gave me structure. And for me personally, that's what I needed to get out of that dip. So what we have to remember is this isn't just for people who've had sepsis. This is for people who've had any type of trauma. So this is cancer, all of these different things, all of these new diagnoses that they're having, rheumatoid arthritis, all of these things. We have to remember that it's not just the condition, it is the person behind the condition, and this is where the biopsychosocial model of health works and is essential when it comes to healthcare. Right, take care guys, and I'll speak to you soon. Take care, bye.